Awesome.
All right. I want to thank everyone for joining us today for this Learning Network webinar on leveraging AI innovations to prevent stillbirths and improve maternal health outcomes. This webinar will be presented by Megan Ockett, who
Mhm.
I'd like to take a moment to introduce. Megan Ockett is the program director with Healthy Birthday, Inc., the nonprofit that created the evidence-based Count the Kicks stillbirth prevention program. Megan is a University of Northern Iowa graduate with a bachelor's degree in history and an emphasis in global health. She has over 15 years of experience with nonprofits and governmental work, focusing on grant writing and reviewing, coalition building, and educational program development. Her true passion is maternal child health. As program director, Megan oversees the organization's research and programmatic outreach. She also manages the free Count the Kicks app and works closely with the medical community on system and policy changes. Megan believes that knowledge truly is power. She uses a Count the Kicks app during her pregnancies and has three healthy and rambunctious children. She is proud to be part of such an important organization with a powerful mission of saving babies. Again, I'll let you all know that we are recording today's webinar and it will be uploaded to the City Match YouTube page following the event. If you have questions, feel free to add them to the chat. Otherwise, Megan will have moments for questions if you'd like to ask out loud as well. And with that, I'll turn it over to you, Megan.
Thank you so much. I really appreciate that intro. And for a second there, I thought you were going to say 13 children. I'm like, no, no, just three children. So, yes, very nice to be here today. I recognize a lot of your names, so thank you for adding that in. If you don't know anything about Count the Kicks or Healthy Birthday, hopefully you walk away today knowing more about our organization, how we work, how we connect with both county, statewide health departments, FEMRs. We do kind of all of that type of implementation. My work involves what Kaylee had said, is it Kaylee, right? Or Callie said. But really, another true passion of mine is systems change. So, how can we integrate Count the Kicks and fetal movement monitoring into different systems, whether it's a health system, FEMR, WIC, home visitor, Healthy Start, and I'm providing the tools and resources for you to do that. So, part of what I'm doing here today, though, is more of my app related work. So I work with our app developers, I work with our app users to make sure everything's running smoothly. I create focus groups and community conversations, meeting the needs of the community of people that are using the app. So I wanted to talk a little bit more about what we have recently been doing around our AI work and specifically with our app and where we want to go from here. And then I also want to talk today about what you can do in your line of work and how you can connect and collaborate with us as well as your community members as well. So I just want to level set. I am no AI expert, machine learning expert. I am purely programming and educational and work for a nonprofit, but I surround myself with experts in this field who are really helping me along this process. My role is really coordinating the efforts, what makes the most sense, and where we are going as a organization, but also as a nation in the world in the AI space. So that's I wanted to level set. I'm not going to get into like the technology and the background of all that tech type of conversation today. More about how we are using AI to the best of our abilities and expanding on it from there. If you didn't know, and I would love to know in the chat how many of you have heard of Count the Kicks before. Just go ahead and put yes, I've heard it. No, I haven't. Looking forward to hearing more. I wanted to share a little bit more about Count the Kicks and give you some background on fetal movement monitoring and the data around stillbirth before I dive into the app and our technology. So, Healthy Birthday is actually the name of our organization, our 501(c)(3). We are based in Iowa. We were founded in Iowa. I'll go into that in a little bit. And then Count the Kicks is our educational programming. And so that is our initiative. That is where we educate on the importance of tracking fetal movement in the third trimester of pregnancy to prevent preventable stillbirths. That is our goal, is to prevent preventable stillbirths. Now, we know that stillbirth and maternal mortality and morbidity are intrinsically connected. So, there are other things that we address with our programming because we're preventing preventable stillbirths. We're also potentially saving mom's life as well and preventing SMM. So, those are just pieces. I'm not going to go into all of the details behind that today. I just wanted to kind of give you a good overview of the background of Healthy Birthday and Count the Kicks and really hone in on the app and our technical side of things. So, Count the Kicks, that is what I'm going to refer to the majority of the presentation. That is our highly effective evidence-based stillbirth prevention program. We developed a proven early warning system for moms. So kick counting has been around for a long time, but the tools and resources and the evidence behind the importance of it and how to have this conversation with pregnant individuals, that is what our founders created and what we've added to that base over the last couple of years. So I've been with the organization for 5 years and I've been in public health for about 15 years. So we've saved lives in 36 states and in 6 countries. And what I mean by that is people have contacted us and said, I was using your app. I noticed a change in my baby's movement. I spoke up and baby's here because of it. Or I saw a poster in my waiting room, or I saw a billboard and I knew the importance of tracking fetal movement. We're really passionate about empowerment and education. How can you educate your community to have all of this information at their fingertips so then they feel informed to go to their provider when something is off or they feel like something's off? So let's just touch base really quick on what is stillbirth and the impact it can have. So around half of the 2 million stillbirths occurring worldwide each year are preventable. Around 2 million stillbirths, which is the loss of a baby after 20 weeks of pregnancy before birth. That is the definition in the United States for stillbirth. There's around 2 million here across the world that are stillbirths, and about half are preventable. So what does that mean for the US? How many stillbirths are we seeing in the United States? Around 21,000 a year. That's around 65 babies a day that are stillborn. We know 1 in every 177 pregnancies will end in stillbirth. And then if we break that down even further, so think through your own demographic, who you serve, your population. This is the breakdown by race and ethnicity. So 1 in every 97 pregnancies for Native Hawaiian or other Pacific Islanders will end in a stillbirth. 1 in 100 for Black pregnancies, 1 in 139 for Indigenous pregnancies, 1 in 216 for Hispanic, and 1 in 223 for white, and 1 in 270 for Asian pregnancies. So what we want to do is we want to close that gap between the white stillbirth rate and the Pacific Islanders, the Black pregnancies, the Indigenous pregnancies. But we need input and we need to work within communities to share this information around Count the Kicks and our evidence-based resource. So that's why it's so important to have partners with you all on the ground, or you that have access to different communities and organizations that can really streamline and help us share this important message within the communities that we want to serve. So I'm not going to go into the severe maternal mortality or morbidity of it. Just know that they're intrinsically connected. You're 4 times more likely to die if you have a stillbirth. You're 7 times more likely to experience severe maternal morbidity. So if we think about it, do we have an opportunity to prevent preventable stillbirth and also save the parent's life as well? Do we have an opportunity to reduce NICU stays? Because what fetal movement monitoring does is identify that something might be going on with baby or mom, right? So we need to think through this a little bit more of, okay, if I'm tracking my baby's movements and I notice something feels off, and I'll get to that in a minute, and I go in, is it something is it something like preeclampsia has not been diagnosed and something was wrong with me as the mom, that can be diagnosed early, and then we can get baby here full term and we can get mom safely, delivered. So there's other factors that I go into in other presentations. And as I talk today, feel free to ask questions in the chat and I'll try to get to them as I go, or at the end. But I want you to be thinking of your organization. what you do and how you can integrate Count the Kicks into your work. How can you bring it to your state or your county or your organization and work with us? Because that's what we want to do. So we know public health programs, we know public health campaigns work. We see that with the Back to Sleep campaign that was created, several years ago, and we've seen a 50, 60, 70% decrease in SIDS related deaths from the Back to Sleep campaign. Look it up, that's on CDC. So if fetal death is a significant issue, and we know stillbirths, some, not all, can be prevented, about a quarter can be prevented. Can we utilize the same practices of like a back to sleep campaign and create this public health program campaign that can dramatically save lives? And that's what our founders did. They had the goal of saving one life with this education back in 2008. And here we are saving hundreds of babies, decreasing stillbirth rates across the nation. We know public health campaigns can be successful. We've seen it. We've seen it in research. We know that public health campaigns in other parts of the world are successful. We have research on that. So the importance of a public health campaign is integral, and that is exactly what Count the Kicks is. So I wanted to stop here and pause to show you what I mean when I say Count the Kicks has saved lives. So this is a story, why this matters and why public health campaigns are so important. So let's watch. So her Gianna story is exactly what I talked about earlier about how she had noticed reduced fetal movement. She went in several times, and this is where the app is so important too, because now with the app you can quantify your intuition essentially. You have a data download of how your baby's been moving. So you can go to your provider and say, look, this is not my baby's normal. I need to be seen. So we'll talk about that in a minute. I want to back up just a little bit more to give you a more comprehensive lens of the research, because I think that based on who's on the call today, there may be some questions about the evidence behind fetal movement monitoring. And I want to address those concerns, and feel free to put them in the chat because, while kid counting's been around a long time, like I said, what's the evidence say? What's the evidence around fetal movement monitoring? And so when we talk about Count the Kicks and kind of how we were formed and created, we were based off of this research that you see on your screen right here, which is a research study from Norway this study showed when pregnant patients were handed a brochure of the importance of tracking fetal movement in the third trimester of pregnancy, the stillbirth rate among this cohort in this study decreased about 30%. Fast forward, and a couple of our founders at the time, who were all lost moms, they were not researchers, they were all lost moms. They heard about this public health research and they said, well, that's great. Like, great things happen in Iowa. Let's come back. Let's look at other research. Let's surround ourselves with experts and create a bright, empowering program. They knew the devastation of a stillbirth and they wanted to create something that was empowering and impactful. So they worked with the Iowa Department of Public Health and a local marketing company to create that bright, colorful Dr. Seussical type materials that you see around Count the Kicks. The app was created in around 2015 as a web-based app. 2017, it started growing more and more. And I'll talk about the growth of the app here in a little bit and how we've incorporated AI into that. So if you really like research and evidence and reading all that, we have a whole evidence page on our website all about research around fetal movement monitoring, as well as other things around stillbirth prevention. but mainly fetal movement monitoring and how we do it. There's two methods that have been researched, the Cardiff method and the Sardovsky method. And the Cardiff method is the count to 10 method, and that's really what we focus on. It's not 10 and 2, it's not 10 and 1, it's count to 10, get to know what's normal for your baby. And I'll talk about that in a minute. Some additional evidence that I wanted to highlight for you was we were published in BJOG, which is the British Journal of Obstetrics and Gynecology, about the reduction in the stillbirth rate in Iowa since the creation of Count the Kicks, which I'll show you on the next slide. So we've had a 32% reduction in the stillbirth rate in Iowa since the inception of Count the Kicks from 2008 to 2018 is when it was studied. And then in the first 5 years of the program, we had about a 40% reduction among the African American stillbirth rate in Iowa. So this is the type of reduction we want to see across the United States, is a 32% or more. That would be amazing. But we can't do this alone. Like, we had partners, and we inundated OBs and doulas and midwives with our materials. And that's where you come into, is connecting us with people and having these relationships. We also did research on our app, and that was published in an AJOG journal. That's the American Journal of Obstetrics Gynecology, that talked about how the app helped decrease anxiety and increase bonding. So those are other common questions I get quite a bit that I don't think I'm diving into today. But the fact that this does not increase hospital utilization. This does not increase anxiety. It decreases anxiety. That's been proven. It increases bonding, and I'll tell you why in a little bit. But this is the 32% reduction in Iowa that I was talking about, just in a graph format, if that's what you're interested in looking at. So I just wanted to highlight some of those things. The other things I wanted to highlight, since we're talking to City Match members, is that we were named a best practice from AmChimp a couple years ago. So that's through a scientific review. We had to submit all the paperwork and get validated that way. So it was named, Count the Kicks was named a best practice by AmChimp. We've been to the AmChimp conferences multiple times. We've presented multiple times. So I just wanted to highlight that if that's of interest to you. And a couple other things before I dive into the app. This is just setting the stage, if you will. Especially in my job, I work with a lot of national organizations to connect the dots and close that gap around fetal movement monitoring and stillbirth prevention and maternal health. And one of those areas that I work with really closely is with our labor and delivery nurses. I shout out to any labor and delivery nurses on the call. Love y'all. But AWON, if you don't know, is the largest, it's the Association of Women's Health, Obstetric, and Neonatal Nurses. It's the largest labor and delivery, national organization. And what we did a couple years ago is I went to them and I said, listen, we are nonprofit, not medical providers. We are getting calls from femurs and clinics and doctors and nurses saying, hey, what should I do when somebody does come in with reduced fetal movement? What should I do when somebody comes in with a change and they need to get checked out? Like, what do I tell them? And I would sit there and I'd say, well, I'm not a doctor. Like, I feel like there should be a protocol for this, right? Like, is there no standard of care? Because then we know clinicians all love, pathways and algorithms and all that stuff. So I went to AWON and I said, would you like to partner with us on a research project that creates an algorithm of what to do when somebody comes into a clinic or triage with a change in fetal movement? And they said, yes, this is a huge gap in literature. Like, let's do this together. And so fast forward 2 years later, where they did a lit review of thousands of research around stillbirth, fetal movement prevention, all of that. They created an algorithm with a team of experts and nurses and piloted that in 11 or 9 sites across the United States, both in high resource and low resource settings, both in more metro and then rural settings. I'm really passionate about rural health. So I wanted to make sure that that was 100% included. And that just happened this summer. And so they're just finalized the algorithm and they tested it and they collected all the data. And right now we're working with AWON to release that data and release the algorithm probably in early 2025, which is just going to be a huge systemic change across the United States in healthcare settings. And that's what I love to do, is how can we create this systemic change? It's going to impact the stillbirth rate dramatically. It's going to impact the way people work dramatically. It's going to be amazing and it's going to be so, so important. So that will be released later in, well, early 2025. But in the meantime, they did release a practice brief on fetal movement that goes in line with our evidence that they got from research. So just another tool I wanted to add. And then, like I said, I love standardization. I love quality improvement, quality control. And so we worked with Dr. Adrienne Burgess and Sarah Coleman, who's on my team, to create, we drafted a journal article that was published in Maternal Child Nursing on standardization of monitoring movement with Count the Kicks. So you can read that too at your leisure. Whew, that was a lot. And that was not even half of what I normally go over. So that was, if you ever want more information on evidence and research and data, like hit me up, like we can talk. But I want to spend the rest of our time talking about really what Count the Kicks is and our app and how what we're doing is moving more towards that AI machine learning type of environment, which will improve maternal and birth outcomes. So first, I need to give you the background of how to count the kicks and how to talk about fetal movement monitoring, because I think this will set you up to know how the app works. And I have some videos to show you as well. But if you're not familiar with Count the Kicks, like I said, is an evidence-based program. But our hallmark tool is really our mobile app, and we have a web-based app. And so what we encourage and what we talk about in our training and education is counting your baby's movements every day in the third trimester of pregnancy. Whether they use our app or they use pen and paper, the most important thing is that people in the third trimester are counting their movements every day around the same time. That's when research shows when people can really start to get to know what's normal for their baby, what the pattern is for their baby. So after a couple sessions, if they're counting around the same time each day, then they get to know, okay, my baby takes 15 minutes to get to 10 movements, and Sarah's baby takes 25 movements to get to 10, or 25 minutes to get to 10 movements. I know mine is around 10 minutes. She knows hers is around 25 minutes. So that's what we want to get the education around. So how the app works, and I'll show you in a minute, is it gives them the trend. So after a couple sessions, it visually shows the app user how long it takes their baby to get to 10 movements so they can see it on a graph. So what we do is we go in and we work with providers and we work with doulas and midwives and nurses and femurs, and we have these conversations about how can you educate your community on the importance of tracking fetal movement. And this is kind of a nice little sheet that walks them through, you're going to time how long it takes you to get to 10 movements. The app really helps with that, or you can use our paper kit counting charts. And then you're going to call your provider right away if you notice a change. And it's all about feeling empowered because now they have data in their hands, especially with the app, which I'll show you here in a minute, has quantifiable their intuition, what they are feeling and seeing. So there's no question for providers to question it. I hear stories a lot where, and I'm sure these, those on the line that are with femur can can validate and say where they, the parent or somebody would call and the nurse would say something like, well, when did you last feel baby move? And they're like, I don't know, like 2 days ago, or I don't know, it was softer this morning. And so this is keeping track of that for the parent to be able to clearly identify and say to the nurse. So then the medical care team can work in that shared decision making together to say, okay, we need to be seen right away. We need to do X, Y, and Z. We want you to come in. So this is what our app looks like on the face. So if you are great at multitasking, which I'm sure you are since we're all on a virtual event here, I would highly recommend that you go into your app store right now, whether you're an Apple user or an Android user, and search for Count the Kicks and download it. Then you can mess around with it. You can create fake pregnancies if you're not pregnant and see how easy it is to use, especially if you are on the call today and you have face-to-face interaction with community members that are pregnant. Download it so you can say, look how easy this app is. I just learned about this. Like, let me show you how it works. I'm not going to go into like all the training and implementation that we do today, but I think that that would be really ideal for you to go in and play around with. So how the app works, and I have a video on the next screen, but you choose a time every day when baby's most active. Maybe that's 2 o'clock in the afternoon because you get a break then and you know baby's active after lunch for you. Or it's 10 o'clock at night when everybody else is in bed and you can finally sit down and put your legs up. Whatever time of day, just make sure it's the same time each day. You sit down, you hit that big red button that start counting, and then there's a clock that shows or a foot. And every time you feel baby move, you tap that footprint. I'll show you what that looks like here in a minute. So after you get to 10 sessions, the app will ask you to rate the strength of those sessions because research says not only should we be paying attention to how long it takes baby to get to 10 movements, but the strength of those movements as well. So the app asks you to rate the strength of those movements. You can add notes in that section. And then what's really cool is you get a graph. So a graph like this that you see on your screen where it shows the strength as a bar graph. You don't see that, but this is the movement graph where you can see this baby, the last 5 sessions, it has taken around 15 minutes to get to 10 movements. So it's a pretty linear graph, right? There might be a couple here, hills here and there, but if I was counting and this was my data, and one day I was counting around the same time, and all of a sudden it took, I don't know, 45 minutes, what happens is the graph changes, right? So it's really up to the user to say, that doesn't seem like my baby's normal. I'm going to call and go in. There are no alarm limits. That is a question I get quite often. Does the app notify the user if they need to be seen? There's no alarm limits, and I'll tell you why as of right now because there's not enough research on that, right? Like we're evidence-based. There's no research right now that states there's a certain like standard percentage deviation between movements that warrants when somebody should go in. What research says is that the pregnant person should go in if they notice a change, if they notice a violent increase, if they notice a decrease, if they notice a change in the strength. So that is why there is no alarm limit, if you will, on the app at this time. And I'll talk about some of our research coming out that we want to do around this. So you can set daily reminders. This is completely free. There are no ads. There's a daily message that pops up after you count that is controlled by us. It's purely educational. Sometimes it's trivia. There's resources. Some states have specific resources. Since I have so many states on here, I'll talk about what that means here in a little bit. But this is completely free. We don't sell, we don't share any of the information. People can mark if their data can be shared for research purposes, and so that it's de-identified and that can be shared, but that's it, and they have to manually mark that. So I have 2 videos here that walk you through, hopefully it works. How do I get, there it goes, okay. And I'll just be talking as it goes. So this is me counting on my own phone. I'm tapping the footprint every time I feel baby move. I hit that how it works button at the bottom. It's walking me through to how to use it. You can undo a last kick session like that in case I, got a little, I started counting hiccups and hiccups don't count, that type of thing. This is where you rate the strength. You can click that little I that gives you information between fluttery to fierce. That's how you're rating the strength. You can add notes here that you might want to download later and share with your provider and your care team. This is how easy it is to use, and then you get a graph. So this is my first session of the day for this pregnancy, and that's how it works. So I have a lot of pregnancies on here because I'm not pregnant, but I practice and play around with it a lot. So here's me counting again on the app, just going really fast for purposes of this presentation today. And so I wanted to share a little bit more about that, how you can, again, undo. I'm doing the strength again. I'm going to show you what the graph looks like after a couple sessions. You can add things like, oh, had a lot of gardening today, or count it a little bit later so they know if something's off or something like that that they want to document. They can download their data and share it with their provider, whether they share it within my chart or at their next visit. So you can see the graph is starting to build. So after a couple sessions, it's pretty easy to see the trend. So there's that video. And then this video is going to show you at the very bottom of the screen there, you see session history, FAQ, resources, and My Zone. My Zone is what you see right now. It's kind of like a Facebook news feed, I guess, if you will, where we have videos that we've supplied, we have resources, We have testimonials, we have submitting feedback. Um, we have the about, we have where this is also where you can change, you can go to preferences and change languages. It's in 22 languages currently. Right here is where you can upload a photo. That's my son Ryder, your contact information, your privacy settings, that type of thing. So you set that all up when you first register. But I wanted to show you today kind of the resources session. In a minute, we're going to talk about Ask Anna, maybe in the next screen even. So let's see where we're at. Okay, I'll get to Ask Anna in a minute, but I just wanted to give you the data from the AJOG study because this seems like a good time to talk about for anxiety. Um, Oh, and I see some questions, so I'll get to those too. 84% of app users stated that regular tracking was associated with feelings of bonding, because what they can do is say, okay, let's count baby brother's movements. Let's read a book and count movements as together, and they can include significant others. You can share the profile. You can be logged in at the same time. 77% of app users reported feeling less anxious. So I just wanted to highlight that. So how are we using AI now? So we've built this tool, right? This free mobile tool that has a lot of data. It's super easy to use. So one of the first things that we did is we just this year wanted to, it's kind of interesting how this came about. It was for a grant that we wrote through Amazon Web Services. We have an amazing app developer, and he helped us write this grant for Amazon Web Services around AI and integrating AI into the app. Well, we didn't get the grant, but our app developer is like, you know what? We're gonna do this anyways. We're gonna add this feature, this Ask Anna AI assistant, because we are passionate about what you do and improving outcomes. And so they helped create this culturally appropriate Ask Anna resource. They did their research on the name Anna and how it is culturally representative in different locations. And because we're worldwide, they thought that was the best representative of the name, Ask Anna, and it just also went with our brand and everything like that. So how Anna works is you can ask any sort of fetal movement, maternal health type question, app related question on the app or on our website, which I'll show you in a minute on our website. And then you can get curated evidence-based answers from Ask Anna. So what we have done is we have worked with Medical Advisory Board team here, and then we also sent in research articles that we have vetted and things like our brochure and stuff to our app developer to build into Ask Anna. So Ask Anna is responding based off research and evidence we have provided and vetted. So Ask Anna is not responding in from Google. She's not bringing in TikToks or Facebook or anything like that. It is purely research-based evidence that has been vetted. It is available in multiple languages, not all the languages yet. That takes additional grant funding. But this is the process of using it on the website. So this is what it looks like right now on the web. What's really cool and what I'm going to dive into next is for quality improvement, quality control, I can go in and look at all the questions that are being asked. There's a disclaimer, so they have to approve the disclaimer. This is, legally saying we're not medical providers, et cetera. But I can go in and see all questions that have been asked. I can see if questions are asked by an app user. If they're not asked by an app user, I don't get any identifiable information, of course. But I can see questions and then I can see answers. So I can see how Anna is responding and make sure that it is responding in a way that we want, that makes sense for the app user. So you can access this, like I said, on the website or our app. And then what I also love is it has the citations of where she pulled in the response. So feel free to take a look at that too as you're kind of playing around with the app and things like that. This is our first kind of move into AI, and it's setting the stage for the AI work we want to do down the road with more research and more funding partners. And I'll talk about that here in a minute. So um, this is how we've started our AI work. Since we launched Anna on September 22nd, you can see the data pull from there. We've had 1,831 questions asked. So that's pulled from September 22nd to, I just updated this for this presentation, November 19th. These are the common themes that I've pulled out, and I have a data analyst who's also helping look at this too. So fetal movements obviously is the top question. How many movements should I get? What about hiccups? What's a pattern, concerns, that type of thing, techniques. Followed by the other common theme is pregnancy stages, like when and how type of thing. And then general provider advice. It seems like there's tends to be a lot of questions about should I drink something sugary or to get baby to move, which I don't go into that in this presentation, but research says to stay away from sugary drinks and the like. Fetal movement monitoring is best done without interventions like that. When should I contact my provider? That type of thing. So those are the common questions that are getting asked right now. What's really great about this is we can improve our programming based on the questions being asked. So if we see a lot of questions come in around hiccups, for example, which seems to be that, I'm going to go to our communications team and I'm going to say, we need to do even more around education around how hiccups don't count towards a movement, or we need to include more of that in our presentation so people know to address that when they're talking about count the kicks and movements with their patients. So that's kind of how we plan to use it currently. We have some researchers that are really interested in looking at this a little bit further, and I'll talk about that in a minute. I wanted to highlight, I know this is a busy screen. I know it's like PowerPoint, like 101 not to do, but I also didn't want to, I wanted to highlight some of the most recent questions that I just pulled, and the answers. So the black grayish is, do I stop counting after 10 movements? So that is literally somebody asked that question. Um, Anna responded with, yes, you count until you reach 10 movements in one daily session. Here's a specific process to follow. And then Anna also added, the goal isn't just to count to 10 and stop, it's to understand how long it typically takes, et cetera, et cetera. The other question that I pulled randomly was, kicks were decreased last night, but seem to be okay today. Do I need to worry? So remember, there's a disclaimer that says we are not medical providers. Ask Anna is not, they have to mark that type of thing. And so she addresses the concern, she talks about it, and then going to the provider right away, and some of those like don'ts type of thing. And then remember, this is my favorite statement, probably, you don't need permission from your healthcare provider to get checked. Tell them that you're going, but trust your instincts. And that's really what we educate on too. And I think, again, the femurs on the call can relate, where go in and get checked out, like trust that instinct, especially in rural areas where you have, maternity care deserts and they have a drive. It's going to take them several hours to get somewhere. Go get checked out. Here's another one around food. That seems to be a common one. Do babies have quick movements after meals? So it addresses that. And again, at the end, it reiterates the importance of and getting to know what your baby's normal is. So this is what we're kind of looking at on really I look at it often, probably a daily basis or multiple times a week. Um, so what are we going to do with this AI world that we're in right now as an AI assistant and tool? And again, this is free, so anybody can use it. So part of what we're doing is looking at, we were named a Clinton Global Initiative Commitment Maker this year, and that was part of our AI Ask Anna work. And our goal is to, well, you can read it. Imagine a world where life-threatening pregnancy complications are caught at the earliest possible moment in time for lives to be saved. So what we propose is, could we use AI to look at all the fetal movement data that we have? We have 6 million pieces of data points, because we have everybody's kick sessions, we have their daily counts, we have how they answer questions. Can we create, using AI and machine learning, a tool or an algorithm to identify risk factors before they're diagnosed. So think back to Gianna's mom's story where she had headaches and then she had that reduction and they went in and they noticed she had preeclampsia at that point. Is there a way that the fetal movement counts can create an algorithm that can identify risk factors before they're diagnosed? Possibly. That's what our research wants to do. That's what we're looking for partners on. Um, in addition to that, can we also improve and work within communities with high stillbirth rate, like those numbers I talked about earlier, to increase app usage within those communities to ensure that we're meeting their needs too. So we're going to have focus groups, community conversations. What are things they like or don't like about the app? How can we improve on it? We do a lot of feedback mechanisms. I recently, one of the things that we're adding is a contraction timer, because that has been feedback that we've received both from providers and parents, that they want like a one-stop shop. They want an easy to use tool that they can, because you can still count your baby's movements during a contraction, right? Your baby should move up to and during labor. So we're adding a contraction timer. We're also adding OCR, so this optimal character recognition. So basically, if you have somebody and, you know, if you are they're filling out a paper kit counting chart, they can scan that and upload it into the app to get into the graph. So if you're a WIC, home visitor, somebody that works with a community that doesn't always have access to Wi-Fi, could you help them after they fill out the chart, scan it into the phone system so they can see it at the library because they can count on the web? So those are some features that we are adding based on feedback from people that use the app. We also ask questions around birth outcomes and if the mom or expectant parent was identified as high risk by their provider. So that's some other research opportunities to see what that kind of birth outcome was for that parent and how they use the app and how it helped identify risk factors or things like that. So we're looking for CGI in particular. We're looking for partners in research, funding that can help fund this continued AI machine learning work and programmatic work. And then this is also kind of busy, but there's 3 additional projects that we're looking at doing with our AI and machine learning work with researchers and funding as we look for that type of thing. So one is developing machine learning based predictive model using our EHR from a health system information coupled with our app data. It's like Project One. We have partners at the University of Iowa who are really interested in and wonderful colleagues and awesome. And then Project Two is really looking at that data, like I said, like the data that we have. We have 400,000 users, currently registered users. We get 11,000 users a month, relatively. So can we look at all their data points and see how machine learning and AI can create commonalities and algorithms? And then most recently, we have a awesome doctor who's also a research scientist in Nevada who wants to really look at our Ask Anna tool and analyze and compare with the public health programming of the app data, really hopefully showing our hypothesis is showing that AI tools strengthen public health. Within marginalized communities, essentially. So these are kind of the 3 main projects I've been working on with researchers and looking for funding mechanisms and things like that to help with that. That's kind of where we're at right now with incorporating AI into machine learning type of things into our app. And that's where I work with our app developer then and, you know, make sure our app is running smoothly. That's really important, is in multiple languages. That's really important, and that it's meeting the needs of the community. So as I kind of wrap up, I wanted to talk through a little bit more of like how you can help. There's a lot of different ways. So one and very important way is educate and share about Count the Kicks and encourage people that you know to use the app if they're pregnant. We want as much utilization as we can because that's going to help with our research. Can you implement Count the Kicks? So what we do is we work with a lot of state health departments and their Title V dollars or their MCV dollars to fund our programming in their state. So the app is always free. So like, it doesn't matter if you live in Ireland, you can use the app. If you live in Texas, where we don't have any funding partners with the state or anything like that, you can still use the app. But what we really need is we need that partner that is going to help fund our trainings and our webinars and our materials, our patient educational materials that you can hand out to the patient about the app. So if you're interested in that, or you have connections in states that you want to make sure know about us, we do presentations a lot. I do a lot with health systems. I have a Count the Kicks implementation guide for health systems. I like that standardization again. So, and then connecting with us. So there's other things too that we offer. Things like our low tech version is our band right here that you see in teal that has numbers on it. So if you work in a rural community or a community that they just don't use a lot of phones or don't have a lot of Wi-Fi access, there's these bands and they can use those with their paper kick counting charts. We have badge buddies that go with nurses and providers. So remember, this is all the public health programming, right? This is a public health campaign, and this is how change happens, is these types of tools and resources. And then I wanted to highlight where we currently are with funding partners. So any state, if you live in a state that's yellow, that means we have some sort of funding mechanism that provides materials for free in your state, whether it's probably through Title V through the state health department, or it could be through a managed care organization. You can go to our website, counttthekicks.org, and order free materials if you're in any of the yellow states. Sorry, California, it's only in 3 counties, LA County, Fresno, and San Bernardino. However, if you are in a gray state, you're not out of luck. You can order materials, you can get access to resources and everything. It's just at a low cost. So my ask of you is, one, to order materials so you can start educating your community, because I live in Iowa. As much as I love to travel, I got 3 young kids. I can't go all over the place. Although I will be in New York in a couple weeks, so hit me up if you're in the New York area. If you're in a gray area, and you have connections with your health department, if you have connections with a managed care organization or a funder, please reach out to us, because we need those partnerships to not only help with our AI machine learning, but just our progress to saving lives. And that is so, so important, that we need your input, and we value that, and we want to hear from you. I will say Minnesota's brand new. We just launched in Minnesota, or we will be, so that should be yellow here shortly. So I wanted to highlight those, and then I think we'll have time for questions, but I'd like to just play one last success story for you, and then I'm happy to answer questions at the end, if that's okay.
She is his best thing. She is a happy baby. I am so thankful she got here safely. I hadn't felt her kick all day, but what I did feel was hiccups. And I'm like, okay, Destiny, she's alive, because I can feel her hiccuping, but I don't know, in my head, I'm just like, something's just not right. It gave me a guide for something that I could do this time. And at this time, I feel like I had learned her. Like, if I drank that day, I tried to drink Pepsi. I tried to get some candy in me, and I mean, she wouldn't budge with the Pepsi, the candy, nothing. I still hadn't felt no kicks. Got in the car by myself, didn't even wake anybody up, because I'm like, oh, everything was fine last night. I'm sure it's just me being paranoid tonight, and they're gonna send me back home tonight. The next thing I knew, I was in the operating room, and she was out within about 30 minutes, and she made the cutest little cry. I'm so glad I counted my baby kicks, because if I didn't, they were telling me that I probably would have lost her, just like my first child, if I didn't go in. That night I did. Count the kicks, I mean, it helped. It really did. It saved my baby's life. It really did. I am so blessed that she got here safely. And I'm so glad I listened to myself this time, and I listened to my body, and I counted my baby kicks. Listen to yourself. Listen to your body. Listen to your baby.
And she even mentioned some of those misconceptions that we talked about, right? Like she knew hiccups didn't count towards a movement, they are involuntary. She tried to drink something to get baby to move, and nothing changed because movements are best done without interventions and the like. So I also have references here, and I know I'll send this PowerPoint out so you all have access to it. But I just thank you for your time today and for this opportunity to share a little bit more about how we're integrating AI into the work that we do, and what this could look like for the future as we grow and find those partners that can really assist with us. Because like I said, I don't know all the technicality, but I surround myself with the experts, and that's how we save lives together. So I'm happy to take any questions that you might have had, comments, anything like that. So I will stop there and see if I can find my little cursor here. Okay, I'm just gonna read here. How have you addressed concerns around data security considering prosecution of mothers in cases of fetal demise? I think that what we have done is we've worked with our legal team to make sure our disclaimer and privacy policy is very, very, it's at the, I think California has the most strict, stringent policy, so it matches that. And so that is kind of where we've leaned into, is making sure that our legal verbiage is as up to date as that. So I don't know if that helps answer your question, but that's kind of what protects us and protects, what they plan to use it for. Um, and then somebody had a suggestion: consider adjusting the language to output results as a standard reading level, 8th to 9th, since Anna's drawing. Absolutely great idea. I will talk to, yeah, our material is at a 6th grade reading level, and our at a glance tools are at a 2nd grade reading level. So I'll work with the app developer to see how we can curate her answers a little bit better to be more at those reading levels that you did. Are there differences in preventability by race? Are there differences in preventability by race? I'm not sure how to answer that. If you're asking if there's different things we could be doing to prevent by race and everything. I mean, there's so many factors that go into it. Um, Racism is a huge factor. I mean, that's been proven time and time again. I think we hear that all the time. So addressing racism in healthcare settings and biases, I think, is really, really key. I think that, ACOG has a list of risk factors for stillbirth. Are we seeing more preventable births for one group than the others? I mean, if you look at the data for what I said, earlier around, like, the most at risk are Black, Indigenous, and Pacific Islanders have the higher stillbirth rates. What are those factors that go into that? I would look at the ACOG notes for that of their stillbirth document. I think they have a 30-page document that lists risk factors. I think that all ties into it as well. Racism's mentioned at the top, though. So addressing those concerns. In our online CE training, we do have a module on race and racism and inequities. And so I think that's something that every health system and those that work within communities can and should be recognizing and addressing. We have a health equity manager that works with us too. And this is where I said, if working within the communities, but getting feedback and having community conversations to ensure that what we create and what we add and what we do is inclusive is really, really important to us too. Any other questions? I'm going to put my email in the chat, though, in case you want to reach out and you have ideas or partners. I will do that.
While you're doing that, Megan, I just want to thank you from City Match and everyone who joined today. This was so valuable and a big learning opportunity, it seems like, for different states. I secretly am going through the evaluation already, and it looks like people are ready to disseminate the information that
Yeah.
you provided. So this was great. The recording will be provided on the City Match YouTube page as well. So I just want to make you all aware of that. If you want to go back and scan some of those QR codes that Megan provided throughout the presentation, or click links. So that's all I say.
Yeah, thanks for the opportunity. And this has been great feedback. So if you have more, let me know. And I'm excited to maybe talk with you all in a year and be like, look where we're at now. We have all this research done and we've done this. So we'll definitely stay in touch and feel free to reach out. I really thank you for this opportunity.
Absolutely.
My fellow Iowa friend. So
Yes.
all of you in sunny states, enjoy the warm weather. It's freezing here in Iowa and Omaha. So
It truly is.
it
All
is.
right.
All
Well,
right.
thank you
Thank
again.
you.
To anyone still on, we do have another webinar coming up on December 3rd from Antoinette Wynn with the CDC, titled Updated CDC Contraceptive Guidelines, 2024 U.S. Medical Eligibility Criteria and U.S. Selected Practice Recommendations. So be on the lookout for our next webinar posting. We'll be sending that out soon. But Megan, again, really appreciate it. Thank you so much for everything you shared today.
Thank you. Have a good one. Bye.